We're taking a closer look tonight at the growing controversy over a vaccine to prevent cervical cancer. That's a disease expected to strike 11,000 American women this year and kill 4,000. Health officials recently have been recommending the vaccine Gardasil for girls as young as 11 and 12. However, problems have been reported for some girls and women who've been injected with Gardasil. And today, a study in the Journal of the American Medical Association is raising new questions. So here's John McKenzie.
It's good to see you. Welcome back.
It's a dilemma for millions of parents across the country. Whether to vaccinate their daughters against a sexually transmitted virus that can cause cervical cancer.
It's for her own health. I did it.
Gardasil, a series of 3 shots given over 6 months, has been heavily promoted.
The right time to protect her is now, because it's about prevention.
So far, more than 7 million Americans have received Gardasil injections. The study out today identifies 12,000 medical problems after vaccination. Most are mild, dizziness, headache, and fainting. But there are more than 700 reports of serious medical problems, including blood clots, autoimmune disorders, and 32 cases of death.
These are initial reports, and I don't think that we can assume necessarily a cause and effect relationship, as many of these women had other underlying medical conditions.
But these reports have already caused some doctors to think twice about the vaccine.
Most doctors I know have stopped giving this vaccine because of the safety issues around it now.
As a gynecologist, Dr. Jacques Moritz sees the deadly effects of cervical cancer. He is also the father of an 11-year-old daughter.
I'm not going to have my daughter vaccinated right now.
Why not?
Because I think there's other ways to prevent cervical cancer, the old standards, pap smear, routine exams, and this vaccine, I just don't know enough about it yet.
Many doctors, it turns out, may not know all they should about Gardasil. A separate, unusually critical study out today says major medical associations have been too quick, working with the vaccine maker Merck, to encourage large-scale vaccination campaigns.
I feel that we don't have enough information or data yet to be able to persuasively say that this will prevent cervical cancer.
Making the decision to vaccinate all the more difficult for many parents and pediatricians. John McKenzie, ABC News, New York.